remarkable. No states in green, Allison, which means what? There are 0 states showing a decline in cases right now?
Yeah, and the last time we saw a map that looked like this was early April.
Okay. Joining us now is Professor William Haseltine. He's a former professor at Harvard Medical School and chair and president of Access Health International. His forthcoming autobiography, My Lifelong Fight Against Disease, is out next week. So no states in decline, Professor. 50,000 plus new cases reported in the last 24 hours. Hospitalizations at a level we have not seen since the end of August. We've been worried about this possible winter surge. It's not even a month into fall, and we're seeing this alarming increase. So what does that tell you?
Well, it tells us that we don't have this pandemic, this epidemic under control. And I'm extremely concerned that the president is being advised by people who speak of herd immunity. Herd immunity is another word for mass murder. That is exactly what it is. If you allow this virus to spread, as they are advocating, we are looking at 2 to 6 million Americans dead, not just this year, but every year. The reason for that is that there is no such thing as herd immunity. These viruses, coronaviruses, come back year after year and infect the very same people. We know that from very detailed studies of the viruses, their cousins, the coronaviruses that cause colds. Every year they come back and infect the same people, the same virus. This is an unmitigated disaster for our country to have people at the highest levels of our government countermanding our best public health officials. We know this epidemic can be put under control. Other countries have done it. We are doing the opposite.
Professor, I just want to underscore what you just said because I think it's so important. This is not the chicken pox. This is like the flu shot that we have to get every year. And the reason we get a flu shot every year is because there's no herd immunity. It comes back every year. And so, in other words, the White House is operating on a false premise. It's based on this paper by a libertarian think tank that I think that Dr. Scott Atlas has kind of championed at the White House. And basically what they are doing, they're embracing this concept. And the concept is let it gallop freely. Let COVID gallop freely, particularly through younger people who seem to not die at the rate of older people. And then they think that that will somehow help herd immunity. But they would protect, they claim, somehow older people from doing that. So therein, I mean, that's a challenge right there. But the whole thing is wrong. I mean, from the get-go, it's wrong. And when you see President Trump at these rallies like he was last night, where he is, I mean, frankly, some of what he's saying there sounds a little bit like a game show. Who has it? Who's had it? Who's immune? I'm immune. Raise your hand. Are you immune? We're all immune. It's just all wrong.
It's wrong, and there is no real evidence that there is immunity, long-lasting immunity. In fact, there's quite a bit of evidence to the contrary. People have been reinfected by the virus that causes COVID. We know that. Absolutely, we know it definitively. And from long studies of the cousins of these viruses, we know how persistent they can be. I'm pleased that you raised flu. People are hoping the vaccine will eliminate this disease. Well, it hasn't eliminated flu. And the kind of criteria being put forward for the vaccines that are now going through, even the ones that have had some trouble recently, is not that they protect you from infection. It's that they moderate the symptoms. They're looking for a vaccine a lot like flu. And we know that flu is still with us. And this disease is a lot more dangerous than flu. There's many indications now it's more transmissible, and it's certainly more lethal. I should also say one other thing about the young people. It's true that on average, young people don't die as often, but more young people are being infected and more young people are now dying. Because you're young, you're not immune.
Look, there's one thing we've seen repeatedly, which is when young people get it, older people get it too. We are not protecting the older populations. People are still dying at alarming rates from this. I want to make sure people understand what has changed over the last few days is that the White House now seems to be explicitly endorsing the concept of herd immunity. There was a background phone call. White House officials who didn't want to be named, they supported this document from this think tank that Allison was talking about that says we need to let young people get infected. When you know that the White House is endorsing this explicitly, it informs your view of the super spreader event at the White House at the Rose Garden. You know, the White House perhaps didn't put any protections in place, let people sit in the Rose Garden en masse, because they don't care if people get it. They want some people to get it. And we learned overnight that another person, I think we have a picture of this, was infected at that Rose Garden super spreader event. This is where Amy Coney Barrett was announced as a nominee.
That's the indoor portion of the event, which is, even more dangerous.
It is. I mean, the outdoor portion, too. People were hugging and kissing. They may have caught it out there. That is the wife of Labor Secretary Eugene Scalia right there. We now know she has tested positive at this super spreader event, which may be called, like they had chickenpox parties. Maybe this was a COVID party. Honestly, it had the same impact of that right now. So now we have this explicit endorsement, Professor, and it does inform what we can expect from the White House over the next few weeks.
Yeah, I think that the point that you're hearing me and you'll hear other public health officials talk about this in very different terms now that it's more explicit. It was implicit in many of the policies. The states were being given instructions by the White House not to enforce rules against bars, not to make masks mandatory. That was implicit. Explicit is another thing. Explicit is close to promoting death amongst our fellow countrymen. As I say, this means the policy that seems to be being followed now is to have 2 to 6 million Americans die this year and next year and the year after. We have to change.
And I just want to end on this note. According to an internal FEMA memo, 34 people connected to the White House have now become infected with COVID. So that's the number that they're using internally, 34 people. Thank you very much, Professor Haseltine. Great to see you.
You're welcome.